Hello friends, welcome back to my YouTube channel Doctorscorner. In this particular video, we are going to discuss about Pulsusparadoxus. It is a very important phenomena to be studied under the subject physiology as well as internal medicine or general medicine. So Pulsusparadoxus, to understand the underlying mechanism under the various clinical conditions. Okay, if you understand the mechanism, this will be a very important tool to diagnose some of the important clinical conditions like cardiac tamponade and other conditions. Okay, now in this topic we'll study under this following headings, or the objectives of this lecture is, we'll first go through the definition of the Pulsusparadoxus, then we will discuss the mechanism or pathophysiology, what exactly causes this Pulsusparadoxus, mechanism or pathophysiology, then we will see some common causes of Pulsusparadoxus, and finally how to measure the Pulsusparadoxus. Okay, we'll discuss under this following headings regarding the Pulsusparadoxus. So Pulsusparadoxus, basically it's a misnomer. Frankly speaking, it's a misnomer. It is actually not at all related with the pulse, or it is a paradoxical phenomenon. Actually, it's a normal phenomena. It is related to blood pressure rather than the pulse. Okay, however, there is a decrease in the pulse amplitude also. We'll discuss that in this particular lecture only. But what is the definition of Pulsusparadoxus? To make this point more clear, I'll just give a background before that. So generally, normal blood pressure, systolic and diastolic blood pressure, systolic is considered as 120 millimeter of mercury, and diastolic as 80 millimeter of mercury, right? So generally, systolic blood pressure 80, then diastolic in the cardiac cycle it will come to, when the heart relaxes, it is 80, then again 120, 80. Okay, now during the different phases of respiration, that is during inspiration when we inspire the air and the lungs expands, and during expiration, that is when we expire the air outside the lungs and the lungs get deflated, right? During this respiratory cycle of inspiration and expiration, normally, I am telling about the normally physiological condition, what happens. So normally during the inspiration and during the expiration, what will happen is, so first I will tell about the expiration. So during the expiration, during the process of expiration and followed by inspiration. So during the inspiration, in particularly the systolic blood pressure, there is a slight drop in the systolic blood pressure, and there is no much change in the diastolic blood pressure during the inspiratory phase. Again, during the expiratory phase, it will come back to its original position, that is during inspiration, the systolic blood pressure, there is a slight fall, and it is a normal condition, not an abnormal condition or a disease condition. So this decrease in the inspiration, that is the systolic blood pressure during the inspiration, I'll explain you the exact mechanism, why it will happen, why the blood pressure will decrease, systolic blood pressure will decrease during the process of inspiration. I'll explain you in this mechanism or pathophysiology. So normally it will be less than 10 millimeter of mercury. Okay, if at all there is a decrease, it will be less than 10 millimeter of mercury. Now coming to the definition of the Pulsusparadoxus. So if the inspiratory fall of the systolic blood pressure is more than 10 millimeter of mercury, then that clinical condition is simply called as Pulsusparadoxus. Now to define what is Pulsusparadoxus, it is the inspiratory fall of the systolic blood pressure more than 10 millimeter of mercury is known as Pulsusparadoxus. Okay, so normally there is a fall in the systolic blood pressure during the inspiration, but in some clinical diseases like cardiac tamponade, constrictive pericarditis, and some pulmonary disorders, this condition is exaggerated. So it's not a paradoxical phenomenon, it is a normal phenomena which is exaggerated. Normally there is a decrease, but in some clinical condition it is exaggerated, and there is a further fall in the systolic blood pressure during the inspiration. That exaggerated further fall of the systolic blood pressure during inspiration is known as Pulsusparadoxus. Hope the definition is clear, right? Now, mechanism. Why actually there will be fall or decrease in the inspiration? systolic blood pressure during the inspiration, why there will be decrease. Okay, so mechanism or pathophysiology. So I'll try to explain this with the help of this diagram. Okay, cardiorespiratory diagram. Here you can see this pink color structures are the lungs, and this is the right side of the heart, that is the right atrium and the right ventricle. This is the left side of the heart, left atrium and left ventricle. Now normally, first I will explain you the normal mechanism why there is a decrease in the systolic blood pressure during the inspiration. So what happens is, during the inspiration, basically during the inspiration, when we take the air inside, then and the diaphragm muscle will come up. We'll explain in detail in the mechanics of respiration how exactly this inspiration will take place. So during inspiration, what will happen is this thoracic cavity will expand. Okay, thoracic cavity will expand, and the intrathoracic pressure becomes more negative. Okay, because of the more negative intrathoracic pressure. Okay, this negative intrathoracic pressure should be there so that the air should be taken inside or sucked inside from the outside. Because of the negative intrathoracic pressure, what will happen is, during inspiration, the venous return will increase. Venous return will increase. Why venous return will increase is, so venous return from this, especially from this superior vena cava, will enter, that is venous return superior inferior vena cava will enter into the right atrium. Because of the negative, that is the suction pressure, negative pressure is there inside the thoracic cavity, so it will suck more venous blood into the right atrium. So venous return is increase. So more increase in the venous return will that enter into the right ventricle. Now more right ventricle, when it enters into the right ventricle, basically what happens is, this right ventricle tend to expand in all the directions. Okay, in all the direction normally, it will also expand towards the left ventricle, that is in the interventricular septal region. So when it expands in the interventricular septal region, it will push the interventricular septum towards the left ventricle. When it push it, then the volume here in the left ventricle, that is the end diastolic volume in the left ventricle, the capacity will be less and the left ventricular filling will be less. That's why it leads to the decrease in the stroke volume and decrease in the cardiac output or decrease in the systolic blood pressure. Okay, so let me describe this in a flow chart like this. The same first mechanism, there are two mechanisms. Okay, this is the mechanism number one which I have just now described. So during the inspiration, what happened? Because of the negative intrathoracic pressure, there is increased venous return. This increased venous return will causes the right ventricle to enlarge. This right ventricle will causes the septum, that is the ventricular septum, to push to the left ventricle, and this will causes the decreased filling of the left ventricle, which leads to decreased stroke volume and the pulse amplitude. Now second mechanism is not only this is the first mechanism, one more second mechanism to explain this Pulsusparadoxus or normal fall in the systolic blood pressure during inspiration. During inspiration, as you know, lungs will be expanding, right? The volume of the lungs will be expanding into the thoracic cavity because of the negative intrathoracic pressure, and the air will enter inside the lungs. So lungs will expand and the volume will increase. Now the pulmonary vasculature are closely associated, that is the pulmonary veins are closely associated with the lung vasculature. They are mechanically attached. Okay, now once the lungs alveoli are enlarging because of the inspiration process, then imagine this is a pulmonary veins or pulmonary vasculature. Now the diameter of these vessels will also expand because the lungs are expanding. Along with that, this will also expand. Because of this expansion of this pulmonary veins, which are connected to the left ventricle or which takes the blood from the lungs to the left ventricle, left atrium here, left atrium and ultimately the left ventricle. So from this pulmonary veins which enters the left atrium, so this pulmonary veins will get, the diameter will get enlarged and the capacity of this will increase, that is the capacitance of these blood vessels get increased and the blood gets accumulated here. It is the capacitance increases and more amount of the blood gets accumulated in this dilated blood vessel during the phase of inspiration. Because of this, the blood entering in the left atrium will be less and ultimately the left ventricle will be less, that is the decreased left ventricular filling and end diastolic volume is less. So when the heart will contract in systole, then the blood pumped is less and the systolic blood pressure is less. The systolic blood pressure is due to the contraction of the heart, that is during the systole. Okay, so the second mechanism is during the lung expansion in inspiration, then there is a pulmonary vasculature also expands, which causes the increased blood pools in the pulmonary vasculature, which leads to the decreased filling of the left ventricle, which ultimately leads to the decrease in the stroke volume and pulse amplitude. So this is the two mechanisms to explain the why there is normally decrease in the systolic blood pressure in the during the phase of inspiration. Normally it is less than 10 millimeter because of the pulling here. That is the first mechanism. Interventricular septum will move to the left ventricle, but the ventricular pressure is more as left ventricular pressure is more as compared to the right ventricle. So, and even the right ventricle can move here also. So this one there is a slight bulging, and this will not cause a major difference. Okay, so that's why the difference is very less. Now, what are the causes of this Pulsusparadoxus? So when exactly there is exaggeration of this normal phenomena? So cardiac causes, most important is the cardiac causes is the cardiac tamponade. Okay, so where we see this cardiac tamponade, so it is a condition in which tamponade, so we'll see this in cardiac tamponade. So what happens is, generally in this cardiac tamponade, fluid accumulates around the heart and it will compress this mechanically the heart, and the heart will be finding difficult to contract, that is the systole, that is to contract and relax. Okay, so because of this mechanical compression during the cardiac tamponade, what exactly will happen is, this is the same mechanism, that is this first one during inspiration. So this right ventricle finds difficult to expand on this other sides, and ultimately the interventricular septum is pushed more towards the left ventricle and it will exaggerate at normal response. Okay, similar thing happens for the second mechanism. Okay, so diseases like cardiac tamponade and constrictive pericarditis. Okay, constrictive pericarditis also, that is there is a accumulation of the fluids because of the inflammation of the pericardium. Rarely it will cause, but the most common cause is cardiac tamponade. Okay, but not in all cases of cardiac tamponade Pulsusparadoxus is seen. Okay, if suppose the patient is suffering from ASD, that is atrial septal defect, or aortic regurgitation, then this even though there is a cardiac tamponade or compression, this Pulsusparadoxus may not be seen. Okay, also some pulmonary causes like asthma. Okay, asthma, pulmonary embolism, COPD, chronic obstructive pulmonary disorders, tension pneumothorax. Okay, will occur in congestive cardiac failure, even in the one of the cardiac causes. Apart from this cardiac and pulmonary causes, general causes like anaphylactic shock and hypovolemic shock, then pregnancy or obesity, that will also accentuate this condition of Pulsusparadoxus. Okay, now finally, how you will measure this Pulsusparadoxus, that is the measurement of the Pulsusparadoxus. So now generally, as I said you, the phenomena is related to blood pressure rather than the pulse, so we have to record the blood pressure. For this, the best device is a manual sphygmomanometer rather than an automatic recording device. A manual sphygmomanometer along with a stethoscope. Okay, so generally you know the recording procedure, auscultatory procedure for recording the blood pressure. So the same procedure has to be followed. I'll just give a rough idea how exactly it need to be measured here. So consider this as a manometer, recording of the sphygmomanometer. Same thing here, I'm just drawing here for the sake of better understanding. So inside this is the mercury column. Okay, inside this is the mercury column. Okay, inside this is the mercury column, and there will be readings. Okay, there will be the readings will be there. Inside this is a mercury column and there will be reading. Okay, so suppose the reading is here 132 millimeter is the systolic blood pressure. Okay, in a particular patient, just I am giving a hypothetical example, 132. Then we have a reading like 130, then we have this one 128, then we have 126, so and so. Okay, so and so up to C 120, then 118, whatever it may be. Okay, here we have 80 or whatever it may be. Okay, so in this hypothetical example, suppose in a patient systolic blood pressure is 132 millimeter of mercury, and diastolic blood pressure in this is 80 millimeter of mercury. I hope you know how to record the blood pressure. If not, we are going to explain in detail in some other video measurement of the blood pressure. So generally, what in the auscultatory method we hear the Korotkov sound. Okay, Korotkov sound. I'm not going to tell in detail how this Korotkov sound will be there. Different phases of the Korotkov sound we will explain you while we make a video of how to record a blood pressure. So generally, this Korotkov sounds will be there in between systolic and diastolic blood pressure. Okay, above this and generally below this there will be no sounds audible. So Korotkov sound. Okay, so Korotkov sounds are first heard. So when we inflate it during the auscultatory method, when we before auscultatory method we should always do the palpatory method, and we should get a rough idea of the systolic blood pressure, and we should inflate the cuff above the systolic blood pressure. Okay, suppose in this condition we have inflated up to 140 or 150 millimeter of mercury, and slowly when we are bringing the sphygmomanometer pressure down, and when we hear for the first sound, okay, I may not simulate the correct Korotkov sound. I will just try to simulate the sound like tah tah tah. Okay, similar sound you will be hearing with the help of the stethoscope while recording the blood pressure. So when you hear that first tah sound, that will give the systolic blood pressure. That is systolic blood pressure. The first sound generally what you hear is the systolic blood pressure in expiration. Generally in expiration. Okay, and during the phase of inspiration, no sound will be heard. Okay, no sound will be heard, and during the expiration, you will get this one. Okay, now one thing you have to note down here is, one precaution you have to take is, while recording the blood or hearing the Korotkov sound or recording the blood pressure to diagnose the case of Pulsusparadoxus, you should never make the person to take deep breathing. So it will accentuate the thing. Okay, so the person should take the normal tidal respiration. It is normal breathing. The person should not do deep breathing. So during the normal breathing only, the first sound what you generally hear with the help of the stethoscope is the systolic blood pressure during the expiration, and during the inspiration generally the sound will not be heard. Okay, so for example, I'm giving just an arbitrary value, need not be exactly the same thing will happen, just hypothetically, theoretically, to make the point more clear I am explaining these things. Don't take this value as a scientific values. So 130 millimeter, around 130 millimeter, again you will hear this sound. So in between 132 or 130, suppose if there is a inspiration, okay, I'm giving this a hypothetical value. So if there is a inspiratory process, and again during 130 millimeter, again there is an expiration process, again you will hear the sound tuck, again 128 tuck, 126 tuck, 124 tuck. That is the sound disappears in between during the inspiration until one phase will come. Suppose during 118, what will happen? This Korotkov sound will be heard during expiration also and during inspiration also. So when you heard during inspiration and expiration, that value also you should record. And suppose if it is 118, okay, and the first sound it is at 132 and second sound is 118. Okay, it's appearing confusing, like I'll make it more clear. So during the expiration, first sound you will hear at 132 millimeter, just imagine. Then the Korotkov sound you will not hear during the inspiration, that is it will again come back during the phase of expiration. So there will be a gap between the Korotkov sound, like tuck 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 tuck, there will be gap, but a stage will come when there will be no gap between the inspiration and expiration. That means the Korotkov sound is audible on auscultation during the both phases, inspiration as well as expiration. Okay, so suppose when it comes to 118, then the same Korotkov sound which was having gap, tuck gap tuck, instead of that, during when it reaches to 118 millimeter, then what will happen? It will be continuous sound, tuck 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 tuck. So that continuous sound is because of the Korotkov sound coming during the inspiration also. So this is the systolic blood pressure during the inspiration, this is the systolic blood pressure during the expiration. So inspiration as well as expiration. So how you can you differentiate clinically is, clinically during the this one only in the expiration means there will be a gap, and during the inspiration there will be continuous. Okay, so it will require expertise to make this sound more clearly. A beginners will not find such a classical gap, but there is a gap. Okay, there is a gap in the normally also, in a normal person also, if you record during the inspiration, but the gap of this systolic blood pressure during the expiration and during inspiration, during the inspiration it will be very less. Also you can make out with the help of the pulse oximetry also, but this is the way of measurement. So during the inspiration suppose it is 118, and during expiration if it is 132, so 132 minus 118, okay, so it will be I think around 14 millimeter, right? So 14 millimeter means it is greater than 10 millimeter, then this condition will be Pulsusparadoxus. If it is less than 10 millimeter, then it is a normal phenomena. Hope the measurement is clear. Alternatively, direct method of blood pressure, that is the direct arterial cannulation, can also record this changes, phasic changes of the blood pressure. Alternatively, if we auscultate on the heart and we hear the heartbeat both during inspiration and expiration, but while simultaneously if we palpate the pulse, in inspiration the pulse may disappear, or the amplitude of the pulse or the volume of the pulse will be lesser, then that will denote the Pulsusparadoxus. Okay, so let me summarize this topic. What is Pulsusparadoxus? Definition. So definition is decrease in the systolic blood pressure for more than 10 millimeter mercury during the phase of inspiration is called as Pulsusparadoxus. Mechanism I have explained you, two mechanisms. Then causes also we have explained you. So most important one is the cardiac tamponade and the pulmonary causes. Then measurement of the blood pressure, how to, with the help of the sphygmomanometer cuff and the this one stethoscope. Okay, so if you like our video, please subscribe our channel and share the video. Thank you.